Good morning. Many of you might be wondering, I haven't been talking about Trump much, but that's on purpose because really he hasn't done anything. I mean, he's made some waves as he always does, but just to recap, this is what he's done since the last time I talked about him. He has a new bromance with the president of France, Macron. He really liked holding my hand. Yeah, so he did that. He inappropriately kind of touched Macron's wife. He thought it was being friendly, but the French don't like that. Yes, because Trump is so naive, not being a politician and all. He just figured it was a woman. Let me just grab her shoulder and pull her in for a big kiss. You don't do that with the First Lady of France, but he did. Trump did it. His Attorney General pick, Jeff Sessions, who was his most ardent supporter. Well, now he's a traitor. Trump would like nothing more than to tell Jeff Sessions, you're fired. He loves his son-in-law, Jared Kushner, stands by him 200%. I mean, seriously, he's the father of your grandchildren. This was always the problem with having a family member so close to you by nominating him and putting him in a position of power in the White House. This is why it's usually not done. This is why the first Bush did not put his son in any kind of a cabinet position or a high up place in the White House. It doesn't look good. And it's really hard to fire someone when they do something wrong, even if you didn't know about it. Even if Trump didn't know that Kushner was meeting with Russians, the fact that he did it means he should be fired. But how do you look your daughter in the eye? I mean, that would be a really awkward Thanksgiving, wouldn't it? Hey, Dad! Jared couldn't make it. He's still a little pissed about the all firing thing and all, not standing by him, having his back. You're his father-in-law. Awkward. This is why you don't put family members, when you're the president, in the White House. You don't hire them, just in case you have to fire them. It's much easier to fire someone who's not going to be coming for Christmas supper. Just my thoughts. What else did he do? Let's see. Loves his son-in-law. Oh, here we go. He's still talking about the election, reliving the election. He was at a Boy Scout jamboree, which, by the way, he cursed at the Boy Scouts. Yeah. Who the hell wants to talk about politics? And then, of course, he went on to do exactly that. The map. And he had to explain what red and blue meant, and the map lit up in red. Really? Really, dudes? The fact that our president says, who the hell, in a televised speech is disconcerting to me. Because, see, I always thought the president of the United States should be a role model for our children. This president is not. He's going to be interrupting General Hospital again today. He scheduled a 3 p.m. press conference, in which, of course, I don't understand why he keeps scheduling press conferences, since he accuses anything that comes out of those press conferences, even if it's on camera, with him saying it, that it's still fake news. He doesn't respect reporters. He doesn't respect our free press, our media. But he scheduled a press conference for 3 p.m. and just at the time when General Hospital, my soap, yes, it's a soap opera, but it is so much more entertaining than Donald Trump is. Well, not every day, but most days. And it is funny, because I kind of liked him better when he was just tweeting. Because, see, I can ignore his tweets. I don't follow him on Twitter. And he certainly doesn't follow me. Not that I'm aware of. Who knows what the Secret Service is doing? I don't know. So, yeah, that's what he's been up to. Reliving the election and the bromance with Macron, cursing out the Boy Scouts, and he loves his son-in-law, and now Sessions is a traitor. Okay. That's about it for the last month. Here's what he hasn't done. And look, most politicians, when they're campaigning and then they become president, they don't do half of what they say they're going to do. Donald Trump hasn't done any of it. Let's see. He hasn't locked Hillary up, like that was ever going to happen. Hasn't put one stone in the wall he was going to build. That's not going to happen either. Oh, and he hasn't repealed Obamacare. That's the topic of today's show. Yeah, hasn't repealed Obamacare, which means I still have no health insurance. See, Donald Trump just says, well, I'm waiting for Obamacare to fail, and then everybody's going to be screaming to me to fix it. Well, it already failed for a lot of us. It failed for me. But I guess, again, Donald Trump doesn't really care about me. There's a lot of people Donald Trump doesn't care about. Who Donald Trump really cares about is himself. Right now, he's more worried about getting lawyered up, which is what he actually predicted Hillary would be doing during the first 6 months of her presidency if she had won. Remember when he said that to all of you and scared you away from voting for Hillary, those of you who were going to vote for Hillary? Excuse me. He said, oh, she's going to be testifying before Congress. She's not going to have time to be president. But she's going to have indictments. She might even be going to jail. Lock her up. He is lawyering up now. In fact, he has just revamped it, and he's fired one lawyer, hired another lawyer. He's got like 4 or 5 lawyers. He even actually asked one of his lawyers if the president can pardon himself. Wow. Even Bill Clinton didn't do that. But he's not really done anything. I'm going to repeal Obamacare and replace it within 1 week as soon as I take office. Wait, that doesn't say January 20. No, it says July 26th. Oops. It's been more than a couple of weeks, and Obamacare is still the law of the land, as far as I know. Here's something I heard last week concerning health care, and it bothered me a lot. This was from a Republican, 2 Republicans actually, who said, quote, Americans cannot be expected to understand the nuances of their health care policy. What? Now, wait, read between the lines. Should I read it again? Americans cannot be expected to understand the nuances of their health care policy. The most important thing you're ever going to purchase for yourself, and you're not supposed to understand it? Now, see, again, this confuses me, because remember, Republicans are less government. Democrats think that the government should take care of everything for you. This is why I don't like the Democrats anymore. But now it sounds like the Republicans are saying, just let us take care of it. We'll take care of it. We'll read all the fine print, and you just pay the tab. You pay for it. Probably won't be able to use it, but you pay for it. Let us deal with all those little, what's covered, what's not covered, how much you have to pay. Don't bother even reading it. You're Americans. You're the little citizen. You won't understand it. Excuse me? I have been self-insured for 20 years. I have changed health insurance companies in those 20 years 9 or 10 times. Every time I changed health insurance and I got that book, I read it. It's not good reading. It isn't. It'll put you to sleep at night, but I read every word that applied to me. Yeah, I skimmed over some of the crap that I would never use. But I read every word of that health insurance policy so that when I did need it or when I thought they should pay for something, I knew what was covered. And all of you should do the same. Don't let these people tell you you're too stupid to read your health care policy. But that's what these people said. Oh, we can't be expected to understand our health insurance. Well, there's 2 reasons for that. Either they think we're really, really stupid, or the damn healthcare insurance policies are too damn complicated. And both are wrong. First of all, it shouldn't be hard. I pay someone, I give them a check, I keep giving them a check, I get sick, I send them the bill, and they pay it. That's all that really needs to be in there. But see, that's not the way it works. And there's a lot of reasons why it doesn't work. And I've already said this ad nauseum. I'm not going to go through this again, but it's because health insurance companies don't like paying medical bills. Which is kind of like a plumber saying, I don't like fixing toilets. Or I don't want to fix toilets. I mean, come on, it's your job. But they don't want to do it. And until Obamacare, now wait a minute, there was one good thing. Until Obamacare came along, they didn't have to. And they didn't, and that was the problem. But the problem with Obamacare is it went a little too far. It went a little bit too far. Look, I am willing to pay a reasonable price for health insurance that I can use day one. Meaning I send Aetna or Health America or whoever a check today. And tomorrow I break my leg. I want that bill covered. 100%. Because I'm not going to cancel my health insurance policy. I'm going to keep paying the premiums. And like, how many times a year am I going to break my leg? They pay for it. What I don't want to have covered under my insurance policy is maternity care and pediatric dentistry. And here's why. I'm 52 years old. I am postmenopausal, meaning I will never get pregnant. And I have no children. So, to quote Donald Trump, why in the hell, and now I'm quoting me, would I want to have maternity care coverage and or pediatric dentistry on my health care plan, especially when I don't have adult dentistry on my health insurance plan? Gee, that just sounds logical to me. Now look, I know where you're going to go with this, and I'm going to discuss it because it's happened. You guys out there are saying, well, you know what? I don't have a cervix, so why should my insurance cover a pap smear for women? Why should it cover a mammogram? Well, first, let me tell you this, gentlemen. Men get breast cancer. There are men out there who have had mammograms. So, forget that one. Here's the thing with preventive screenings. And by the way, I agree with you. I used to think it was a good idea to cover cancer screenings. I'm not so sure anymore. I'm not sure about that because the screenings in of themselves are affordable. They are. I can afford even the outrageous price, and I do think they're overpriced. $600 for a mammogram. I get a mammogram every 3 years. That's my choice, but I do it. And I'm healthy, knock on wood. Something here is wood. I can afford to do that. What I can't afford to do is pay $600 for a mammogram every 3 years while I'm paying $8,800 a year for a health insurance premium with a $7,500 deductible. I'm not going to do that. What I think should happen, and this is sad because I'm completely reversing my last opinion when Obamacare came in. I think it should go back to the way it was, but simpler. No more of these co-pays and this and that, and only that part goes to deductible. Here's the thing. Give me a reasonable premium, okay? Give me a low-ball deductible, maybe $1,000 a year. I would prefer $500 a year, like my car insurance and my homeowner's insurance. But I'll go for $1,000. But then I only expect to pay maybe $300 a month for a premium, okay? Now, the thing of it is, whatever the deductible is, whatever I pay out of pocket, I get that mammogram, $600. The entire $600 goes toward my deductible for the year. Why not? I'll pay for the pap smear, $250. maybe $300, goes toward the deductible. But I'll pay it because I can afford that. Here's what I can't afford. I can't afford to have a heart attack because that's like $50,000. I can't afford to get cancer if I want to get treatment for the cancer. I can afford to get tested for cancer. I just can't afford to treat it if I have it, if I choose to treat it, which I may not. But again, I should at least have the choice to save my own life by having insurance pay for that cancer treatment. All of it, 100%. No more of this, oh, we don't cover that because we don't believe it works, or this is too expensive, or this is outrageous cost, whatever. No, you pay it. I'm paying you in good faith. I get really, really, really sick, you pay the bill. I think that's really fair because I may never get cancer. I may never break my leg. I may never have a heart attack. So we're both gambling. I'm gambling. I'm giving them my money. I'm never going to get it back. They're putting my money in a very good bank account where they're getting tons and tons of interest on it. And the only way I get my money back is if I get really, really sick and then really, really miserable, which will make me upset. But at least I won't have to have another heart attack when I get my hospital bills that I have to pay for. I love it when someone says, oh, I had a heart attack. And then when I got my hospital bills, I had another heart attack. When I realized what I had to pay. Or I almost wish the first heart attack had just killed me because I can't afford to pay the bills. That's wrong. So yeah, I have reversed myself. And when I'm wrong, I say I'm wrong. I thought because all of my medical expenses when I was younger were for preventative tests. And I didn't like paying for them. I really hated paying for them out of pocket. But my insurance premiums were really, really low. Like for me and my husband, $400 a month for both of us with a $2,500 deductible. That was our best insurance ever. They didn't pay for any of the little bells and whistles. They did not pay for dentist, for anybody. They didn't have pediatric dentists in there either. We did not have to pay for maternity care. Obama is the one who forced that on everybody. We had no maternity care because we weren't getting pregnant, and we knew that. But we had to pay out of pocket for everything. But the thing is, if we got diagnosed with something, $2,500 out of our pocket, and the insurance covered everything after that. No questions asked. No co-pays, no little, well, this, that, whatever. No. Everything was covered because I read the policy. And I told the guy who sold us the policy, this is what I want. And he gave it to us. And by the way, that health insurance company was not in the state I live in Pennsylvania. Thanks to Obama, I am not allowed to buy an insurance policy in a state that I don't live in. I have to buy my insurance policy in Pennsylvania. And guess what? For self-insured people, there's only one now, thanks to Obamacare. You see my point? I hope I'm explaining this well. I really do. I think when you hear a personal story like this, and then when you hear my ideas, which sound really logical to me. Now, maybe, I don't know, maybe I'm having an episode. I don't know. Maybe what I just said in this show sounds completely ridiculous to some of you. But remember this too, for those of you who say, well, I don't want to pay for a pap smear or for some chick to get her boobs checked. Well, you know what? Us girls don't want to pay for you to get your dick checked either. I'm sorry for the children who are watching. I had to be a little crass. But I don't have a prostate. And yet I pay for that. And you know what? Preventative care is different. It is different. Maternity care is only for women. So yeah, you guys out there who have maternity care, you single guys, maternity care, you gay guys, you gay women who have maternity care on your health insurance policy, you should be furious. You're not getting pregnant. But everybody, men and women, and preventative care is lopped into one big category. It's not just the pap smears. It's not just the women's stuff. It is your prostate exam, your colonoscopy. If you need an endoscopy to test for something because you have something going on with your throat or your lungs or your stomach, and also that's covered. So that's kind of gender neutral, binary, whatever, non-binary. Everybody in their life is going to need a preventive cancer screening or a test for cancer. So that actually should be covered. But if that provision went away and my premiums went back to what they were before Obamacare with the lower deductible, I could live with that too. Going to the doctor when you're healthy just to hear the words, oh, guess what? You're still healthy. That's a choice. And it's a choice that I choose to say no thank you to a pap smear. Maybe I'm wrong, but I choose to. And I'm allowed to do that because I'm an American adult. It's my choice. And I choose to not have a mammogram every year. I go every 2 to 3 years, depending on my mood. And of course, my financial status. But, I can afford a mammogram. I just don't care to have with all the lab errors and the false positives or false negatives, whatever, I don't really trust the results either way. If they tell me I'm fine, I don't care because they could be wrong. And if they tell me something's wrong with me, I'm getting a second opinion anyway because I don't care because I've had lab errors in the past. So I don't trust them either way. I don't get that letter that, ooh, your mammogram came back and everything's great. I throw it in a folder to prove it, that they said it, in case I have to sue them because they missed something. But I don't trust it. I don't go around going, ooh, yay, I'm going to live forever. I know better. They make mistakes. They miss things or they get too cautious and they diagnose something that isn't actually there. Like with my cervical cancer scare back 11, 12 years ago, which obviously I don't have cervical cancer, or guess what, folks, I'd be dead. Yeah, so I don't trust them anyway. So as far as that goes, I would have no problem if insurance didn't cover the preventative tests. And by the way, they only cover the preventative. They only cover when you go in and you're healthy. Your just-in-case test, just to find out. Once you have a bad test, all the future testing, that's on you. Insurance, that starts the deductible rolling. So don't think that, oh, I had a mammogram and it came back bad and now the next one's going to be free too. You're paying for the next one. Until you meet your deductible, you'll be paying for all of them. And the treatments and the surgeries and everything else till you hit that magic number set for you by your friendly neighborhood insurance company. So there you have it. That's my take. We do need healthcare repeal and replace. We do need it. We need a different healthcare system for our country. They don't pay me enough to figure that out. If I had the answers that someone would actually listen to, I would be in Washington right now, voting alongside John McCain, who bravely has returned to Congress today to try to repeal and replace Obamacare with compassion and with something that will help all Americans, not just those that are getting it on the cheap now, and the middle class like myself and my husband are paying for it, and then the rich people are getting all the tax breaks for it. And God bless John McCain. If I was diagnosed with brain cancer, as he was last week, I would be retiring and relaxing and working on my recovery and spending time with my family. And instead, John McCain is in Washington, back at work for us, for the people who elected him. He is a warrior. He is a maverick. And I do appreciate you, John McCain, and we still send our thoughts and prayers to you and your family. And if anyone can beat this awful disease, you will. You're going to beat it, buddy. So please, vote for us. Vote for me, for people like me. Because when Donald Trump flippantly says, oh, I'll just let Obamacare fail, and then, we'll wait for Obamacare to fail, and then everybody will want me to take care of it. And I'll ride in on my horse and like a shining knight and take care of it. Well, guess what? Congress, senators, Mr. Trump, Jared, Obamacare already failed for me. I'm waiting. Political Paula, out.